When given the option to have an outpatient surgery, most patients would jump at the chance. But when it comes to same-day joint replacement surgery, you need to make sure you're a good candidate for the issues you're having. To tell us more about the process is Dr. Brittany Boisvert, a board-certified orthopedic surgeon with Emerson Orthopedic Associates. This is HealthWorks Here. I'm your host, Caitlin White. So, Doctor, what is same-day joint surgery?
So same-day joint surgery really is exactly as it sounds. It's folks who have a typically knee or hip replacement, and they come in that morning for their surgery, and they're back home at their own house later that afternoon or evening.
And what are the benefits of this type of procedure?
So obviously one of the biggest benefits is that you don't have to spend a night in the hospital or 2 or 3 nights in the hospital, as has been sort of the traditional hospital stay surrounding joint replacements in the last decade or so. Most folks will find that they are much more comfortable at their own home, in their own surroundings, without having to be awakened several times throughout the night to have their vital signs checked and waiting to get their pain medication. So there's a lot of benefits from that standpoint just for the patient comfort level. Also the benefit of not being in a place where there are people who are sick. When folks are having joint replacements, they're typically healthy people who really are just looking to get back to doing their activities, and to keep them out of the places where folks are coming in with pneumonias and other types of infections before treatment can be really helpful to help minimize any complications they might have from the surgery.
So who would be a good candidate for this kind of surgery?
So some of the best candidates are folks who are on the younger side. And when we say younger side for joint replacement, it's typically people in their 50s, 60s, but we've even had folks in their 70s and approaching 80 who have done same-day joint surgery, and it really just depends on the patient. You know, we look for folks who obviously are already active and sort of robust. We certainly wouldn't want to send someone who might be a little bit on the frail side back home without having a lot of help. So we look for folks who don't have a lot of medical comorbidities, certainly nobody with any significant cardiac or pulmonary history, where we would want to keep an eye on those people overnight after a big surgery like a joint replacement and with general anesthesia. We also worry a little bit about folks who might be on their own. So that's another thing that we really talk about beforehand, is making sure that people understand what's involved with the same-day surgery and with a joint replacement in general. We talked a lot about patients having someone at home as a support person who can help them to maneuver around the house. You know, if they live on the 3rd floor, that's going to be very difficult to do the same day of having a knee or a hip replacement. So a lot of it has to do with what their home setup is like I said, having a support person available for a few days after the surgery, and also their motivation. Some folks, the idea of going home the day of that surgery just doesn't appeal to them, and certainly we don't want people to feel like we're pushing them home. We want it to be for the folks who just really feel comfortable being able to be back in their own surroundings. So there's certainly a lot of things that goes into the selection of the folks that really are candidates for it, being, like I said, on the healthier side and having that support system around them and being interested in it. It's not something that has to be done, but it's definitely the trend towards shorter hospital stays and getting people back into their homes.
So how is pain controlled afterwards?
So one of the biggest things that has come along that's allowed us to really make this transition is a medication called Exparel, which is essentially a long-acting numbing medicine. So it's something that we inject into the tissues at the time of the surgery. And so it really minimizes the amount of pain that patients will have when they wake up. It also minimizes the amount of pain medication that the anesthesiologists need to give during the surgery. So when patients wake up from their surgery, they're really not as groggy as they might have been in the past, where the anesthesiologists are giving them lots and lots of medications through their IVs and through gases. So when they wake up, they have less pain. And that then really persists it lasts for about 72 hours or so. So most of our patients at this point really aren't using anything for pain management other than Tylenol, and sometimes it might be Ibuprofen for the first few days. We typically do give, still prescriptions for pain medications for those who need it, but it's really minimized the need for narcotic pain medications following the joint replacement by using this sort of adjunct to the pain management and anesthesiologist regimens. So it's really been sort of a game changer in terms of allowing us to really get patients up and moving and walking around the same day of surgery with very little pain, and seeing that they can do it and that they're safe to do it. so that then when it does wear off and they're uncomfortable, it's not as bad because it's been a few days since the surgery, but they also know that it's okay and that they can still do all of these things without having any problems.
Tell us about what research shows about the effectiveness of same-day joint surgery.
So it's relatively new, so there isn't a lot of necessarily robust research papers or studies about it. We certainly do know that keeping people out of the hospital and not using things like Foley catheters and other things like that really will help to minimize the risks of what are considered sort of hospital-acquired complications. So hospital-acquired pneumonias, decreasing the rates of DVTs and PEs because people are being up and mobilized, so that risk of blood clotting is really minimized after a joint surgery. And certainly the risk of an infection associated with a Foley catheter, urinary tract infection, obviously is going to go down since we're not even using them. So it's definitely sort of in the early stages. So there's not necessarily a lot of significant, robust research about it at this point, but it certainly has been an ongoing process, and I think there will be a lot coming out in the near future that shows that patients have a much quicker recovery and return to activities with this approach.
So wrapping up here, what should patients know in order to decide if they should have this surgery?
I think a lot of it really depends, as I mentioned a little bit, on patient motivation. Like I said, for the folks who are interested in surgery but not necessarily interested in having to spend time in the hospital or feeling like they're really losing a significant portion of time out of their life, this really is a great option. And really it's something to talk about with their family and with their support, friends and people around them who might be able to help them out after the surgery. It can be a really excellent experience for the vast majority of patients that we see in the office who are ready to have their joint replacements and to get back to all of their regular activities without that pain associated with arthritis, so that they can participate in family activities and not feel like they have to miss out on things because it's going to hurt. So we're certainly happy to speak with anybody who has any questions about it. And really, it's open to almost anybody that wants to learn more about it. And like I said, we would have that conversation if it might not be the safest thing at this point. Certainly our main goal is to keep everybody safe through the process.
Well, thank you so much, Doctor, for sharing your time and this information with us. To find out more or to get in touch, you can call 978-371-5390. That's 978-371-5390. Or visit emersonhospital.org/orthopedics. You can also visit her webpage to see a video of a patient who had same-day joint surgery performed by Dr. Boisvert. Thanks for listening to Emerson's HealthWorks Here podcast. Make sure to catch the next episode by subscribing to the HealthWorks Here podcast on Apple Podcasts, Google Podcasts, Spotify, or wherever podcasts can be heard. I'm your host, Caitlin White. We'll see you next time.